Hello everyone, good morning, good afternoon, good evening. Welcome to Live It Up, the show where we explore and discuss how to take your life to that next level and beyond. We cover health, wealth, relationships, and how to create a life you absolutely love. I'm your host and coach, Fletcher. Amy will be joining us in a few minutes as we learn about sleep apnea. What is it? How do you develop it? And what do you do if you're one of the millions of Americans who are dealing with it? Remember, health is the first wealth, so stick around. As a reminder, if you have questions that you would like us to address on or off the air, send them directly to me at fletcher@fletcherellingson.com. Okay, let's get to today's email, which comes to us from Sam. It says, "Dear Fletcher, I have come to the conclusion that I have officially plateaued and am spinning my wheels, not just in my business, but in my marriage, my attitude, my relationships. I keep coming up against the same obstacles over and over, and I'm asking myself, is this as good as it gets? Maybe it is, and I just need to accept it. What do you think? Sam." Hey Sam, first of all, thanks for reaching out. Asking for help is always a sign of strength. And I hear what you're saying. You feel like you've plateaued in life in general. You keep coming up against the same obstacles and getting the same results. On this show, you're going to hear me talk a lot about two things: thinking and patterns, and specifically patterns of thinking. One of my favorite quotes is from Einstein. He once said that we cannot solve our problems with the same thinking we used when we created them. I love that. You've heard me say before that we're always doing our best with the tools that we have. Well, consider this may be your best. It may be as far as you can go with your current level of thinking. And that's not good or bad or right or wrong. It just is. You see, when people invent new products such as the light bulb or airplanes, rockets, iPhones, computers, it always requires a new level of thinking. There's actually a method to creating new thinking. Isn't that cool? Most of us think we're thinking throughout the day when in fact we're just reacting to what's in front of us or the images that we're focused on in our mind. We're usually just on autopilot, going through the day, which is comprised of our patterns and our habits. And that isn't really thinking, it's just reacting. When people like Steve Jobs or Malala or Elon Musk or Oprah Winfrey, to name just a few people, when these people took on their dreams and challenges, when they took on their lives, they had to develop new ways of thinking that allowed them to be and act in new ways, which then generated new results. We must embrace new ways of thinking in order to get new results. We have to get to a place of vulnerability, willingness, and openness in order to access that new way of thinking. And when I say get to a place of openness, what I mean specifically is being able to consider something without your preconceived judgment, your judgments and ideas. So what am I really talking about? Well, what I'm really talking about is something radical. I'm talking about doing something that most successful people in the world do in order to create outstanding results. I'm talking about reprogramming your mind. I'm talking about learning to put in new programs that will allow you to consider things through a different lens, so to speak. And how to get yourself to think and act in different ways so you really can get different results. Now, I know that sounds like a pretty big deal, pretty big project, and it is. But you start by finding people who have already done this, who are thinking differently, that thinking in a way that have allowed them to achieve what you want to achieve. You see, you model success. You get around them, ask them, how did they do it? You begin reading about how to program your mind. You begin reading about how other people have done it. Listen to podcasts, get that information that is out there, and then begin implementing it. Find a mentor or a coach like me and work with them to help you interrupt the patterns in your thinking so you can develop new pathways in your mind. Now, does it take effort? Absolutely, but I guarantee you it will be rewarding. And as soon as you start down this path, you're going to feel excited. You're going to feel challenged in a good way, and you're going to begin experiencing growth, which is the opposite of feeling like you have plateaued. And ultimately, you're going to get those new results. You'll see that you don't have to wonder, is this as good as life gets? You don't have to really consider that from a deflated viewpoint. You'll be able to declare that life is incredible and exciting and a beautiful adventure. So Sam, finally, I want you to stay in this personal development conversation. You can do this, and I believe in you. All right, we're going to take a short break, but when we come back, we're going to be visiting with Amy, who's going to be teaching us about sleep apnea, what is it, and what is there to do about it. Stay tuned. Hey, welcome back to Live It Up. We are here with Amy. Hello, Amy.
Hello.
What are we talking about today?
Today we're talking about sleep apnea.
Okay, well, my first question is, what is it?
So sleep apnea is a sleep disorder that can be pretty dangerous, and it happens where your breathing, or what happens is your breathing repeatedly stops and starts during the night.
Okay.
And well, I'll tell you, I'm just going to launch it. There are two types. One is the most common one, which is called obstructive sleep apnea. And this occurs when the muscles in the back of your throat relax during the night. And so all the things that are in the back of your throat, the tissue, the uvula, which is a little thing hanging down the back of your throat, your tonsils, when everything relaxes, it kind of compresses on your airway and blocks your airway. So when you go to sleep in the night, then that's what's causing snoring and sometimes gasping. And this can repeat itself even like 5 to 30 or even more times during the night. 5 to 30 times every hour.
Whoa.
And I mean, you're talking like hundreds of times a night. And so it really impacts your ability to get deep sleep. There's a second kind, which is a little bit less common, or much less common, called central sleep apnea. And that's where something in your brain is failing to transmit the signals to tell you to breathe. And so you just won't breathe for a short period of time. I mean, it's not usually long enough to, kill you, but it definitely disrupts your body's normal physiology.
And then the effect of both of these is ultimately you wake yourself up, you jar awake, or
not necessarily as much for the central sleep apnea, but for sure for the obstructive sleep apnea.
Okay. Well, what causes both of these types to happen?
So the obstructive sleep apnea, which again is the most common one, so having excess weight on your body, because it greatly increases your risk of sleep apnea, because you'll have fat deposits around your upper airway that you maybe don't, we just think of fat on the outside of our body, but we have it deposited on the inside of our body too. So that narrows the airway. Also, people that just how they're built, if they have a thicker neck, they also are going to have excess soft tissue closing in on the airway when you're relaxed. If you had a narrowed airway for some reason because of tonsils or adenoids, because even kids can get sleep apnea when they have really big tonsils. Being older, it's much more common in older adults, having a family history of sleep apnea. Smokers are 3 times more likely to have sleep apnea. We don't totally understand that. It might be because of inflammation in the upper airway. And then if you have problems with allergies and sinus issues, that's for obstructive sleep apnea. The risk factors for central sleep apnea would also being older, being male, much more likely to happen, using narcotic medications like pain medications or other medications that are sedating at night, and also a history of stroke because your brain is impaired.
Okay. Does this only happen in adults? It doesn't happen in kids?
It does happen in kids. The obstructive kind is what usually happens. And actually, there are some children that need to get their tonsils or adenoids out because they're not sleeping well. So yeah, you'll hear, I'll examine a child and they have really big tonsils and ask the parents, do they snore? Do they seem tired during the day? And kids definitely can have sleep apnea. It's not as common, at all, but it can happen.
All right. And so this can happen between 5 and 100 times an hour?
No, 5 and 30 times an hour.
5 and 30 times an hour?
Yeah, but hundreds of times a night.
Wow.
Yeah.
Okay, so that's definitely going to take a toll on you the next day.
Which we'll talk about it.
So why do we hear so much about it?
Well, because it's really common. So about 18 million Americans have sleep apnea, and about 24% of adult men have obstructive sleep apnea. And it's becoming a lot more common because something we've talked about in the show is that Americans are getting heavier and the obesity epidemic, and so we're definitely seeing more of it.
Okay. Well, I know you've talked about the importance of sleep in a previous episode, but why is this dangerous? Is it because we're not just getting enough sleep, or why else? Yeah,
and so this is not just dangerous because of getting poor sleep. It's a really significant strain on the heart, lungs, and brain, and we'll talk about the complications here in a minute. But that's even on top of all those other things that happen when you don't get a good night's sleep, which we mentioned on the other show.
Okay. How do you diagnose it?
So usually, and people have heard of this, you usually have to go to a sleep center and they hook you up and then they check your breathing, your oxygen levels, your blood pressure, your heart rate, that kind of stuff, all through the night. And that's usually the gold standard, what we usually do. There are some home monitors to do, but the results of that aren't always sufficient for your insurance company to then pay for your CPAP machine. So you just talk to your doctor. It's usually best to do an overnight sleep study at a sleep center.
Gotcha. And so it's not something that they can come and see you for, they have to go do this particular study?
Yeah, sometimes we'll do an overnight oxygen test and someone just wears a little probe on their finger. I'll sometimes do that just to convince either myself or the patient, like, gosh, this really is what's going on. And then the patient's like, oh my gosh, my oxygen saturation gets down to 75. Okay, I'll go. And we'll use that, but it's not sufficient to diagnose it.
Would somebody have a pretty good idea if they had it?
A lot of people do, actually. A lot of people do. And we'll talk about the symptoms here after our commercial break, but either the spouse or the person knows they have it.
Okay. Well, speaking of commercial break, it is that time. So we'll be back in just a minute and talk more about sleep apnea and what to do about it. Stay tuned. Hey everyone, welcome back to Live It Up. We are here talking with Amy. The topic today is sleep apnea, and we've been finding out what it is, and now she's going to tell us about some of the treatments for it.
Yeah, so again, the most common form of sleep apnea is obstructive sleep apnea, like I mentioned. And so usually what people use is a CPAP machine. And people have seen those, or a mask that you're either over your nose and mouth, or a lot of people now use ones just over their nose. And it's pretty cool what it does is because it provides a small amount of continuous pressure. So it literally just mechanically keeps your airways open.
Is it like forcing air?
It's forcing air, so your airway never collapses like it was when you're having sleep apnea. So then you're not snoring and you're not blocking off your airway because of that continuous pressure. Now, some people find that continuous pressure uncomfortable, or they don't like the mask. But what I've heard, the overwhelming majority of patients feel so much better when they get their sleep apnea treated. They're not snoring, they feel rested, they have a good night's sleep. Their partner's even happier because even though there's that hum of the machine, there's not the snoring and the disrupted sleep. So I would say that most people feel really positive about getting treated for sleep apnea. And then also, I'm definitely no expert on it, but the people that supply your CPAP machine and the supplies, they're really good at fine-tuning, figuring out if you need a different pressure, a different mask, different fits to make sure it's comfortable for you.
And then you just wear that the entire night?
You wear that the entire night, or as many hours as you can. So say you got 6 hours with your machine and you got 2 without, that would be acceptable, but you would definitely want the vast majority of your night.
Okay.
With the machine. There are some oral appliances that you can get with your dentist, and they may, obviously they may be a little bit easier to use, and they kind of just help adjust the mouth to keep the airway open. These may be able to be successful in a more mild case of sleep apnea. So you can ask your dentist about that option.
Is that something like a mouth guard or something?
Kind of, a form of that. And then surgery is another option. I've had just maybe less than a handful of my patients have had surgery, and that may be bringing the jaw forward. It may be removing some of the tissue in the back. They actually can remove your uvula and part of your palate to open that up, and that would be a more long-term fix.
So besides the CPAP machine and going to extremes like that, is there something else that can be done just by adjusting your lifestyle?
Yeah, definitely. And I always like to talk about that. So even a slight amount of weight loss, so 10% of your weight, if you could lose that, so say you weigh 180 pounds, that would be 18 pounds that you would lose. That can significantly improve obstructive sleep apnea and the constriction in the throat. And sometimes I've had patients where they've completely resolved their sleep apnea because they've had such success with their weight loss. So losing weight would be the first thing to consider. Also, avoiding or stopping alcohol or other sedatives or sleeping pills, tranquilizers at night, because those make you relax so much that everything is relaxed. So sometimes people say, well, I only snore if I drink alcohol. Well, that's because everything is so relaxed in your airway and you don't have the normal kind of tightening that occurs in the night that needs to occur so you don't snore and collapse your airway with alcohol or sedatives on board. The other thing is sleeping on your back sometimes is enough for people, or your side. And they even have, I'm sorry, not sleeping on your back, sleeping on your side, because sleeping on your back is going to be the problem. So they even have commercially available things you can look on Amazon that you strap to yourself, or you can even attach like a tennis ball to your shirt, like with a safety pin. And that way, if you roll over, it'll wake you up. And so you'll stay on your side. That can be helpful. And then obviously, like I mentioned, that a smoker has a 3 times higher chance of having sleep apnea, so quitting smoking, which I know is not easy, but obviously there's huge health benefits.
And it can be done.
It can be done, for sure, yeah.
Okay, and you said just even losing 10% of excessive weight.
Yep. Mm-hmm.
Yeah, so it's just a minor adjustment.
Yeah.
Can this condition be reversed if you have it?
It can be. I haven't seen it happen a lot, but I've definitely had patients that have reversed it, and that's usually through significant weight loss.
Okay.
Or surgery. Those two are the other things that, or again, say someone was an alcoholic or taking sedatives at night and they were able to stop that.
What, in your mind, what stands in the way of people being able to reverse it? Because that's a lot of people that have it.
Well, everything you talk about. So mindset is the, continuous adjustments of your mindset is the only thing that's going to allow you to change habits. Mm-hmm. And that's very difficult for people. And so that's what stands in their way of losing weight, because everyone is wanting to go toward what's comfortable and what they know.
Got it. Mindset.
Yep.
All right. What if someone doesn't know they have it? What are the telltale symptoms?
Yeah, so you asked about that earlier. So loud snoring. If someone that you're sleeping with or comes by your room at night, like say it's a parent noticing a child that they've stopped breathing, or they're having episodes where they've stopped breathing for a few seconds.
Oh, so what would that look like? I mean, how would you know that they've stopped?
I'm not really going to imitate it on TV, but
I mean,
they literally would stop breathing. They would kind of choke, like gasp, or kind of you hear like kind of sound, and then they stop breathing for maybe 1, 2, and then keep breathing.
And then is there a gasp or something after?
Maybe.
Okay.
Yeah, a little bit. So it's just really disrupted breathing, and so gasping, that'd be another thing where people are kind of sound like they're choking, is what it can sound like.
Got it.
And people, for the patient, if waking up in the morning with a really dry mouth, having morning headaches, trouble staying asleep. Some people just feel like they wake up all the time. They can't sleep well, but that's actually what's happening. People that are really tired during the day, so if you know one of your loved ones who's falling asleep at the table inappropriately or is falling asleep while driving. I had one patient who fell asleep while driving. It was really scary for her, obviously, and she was actually found to have sleep apnea. She didn't know she had it and was treated, and so now she's doing great. Even people with depression may have sleep apnea, because really what they're feeling is irritability and fatigue, and they think it's depression, but it's actually sleep apnea. They're not getting enough sleep. High blood pressure that is being resistant to treatment. So you might have a doctor may have a patient on 2 or 3 medicines, like, gosh, this is not getting any better. It might be because they have sleep apnea that's not being treated. I've seen some people with nighttime reflux, or also ankle swelling. Those can be signs of sleep apnea, and when it's treated, those go away.
Ankle swelling?
Mm-hmm. Yeah, you can get a little bit of water retention on your ankle because of what's happening to your physiology.
Wild.
Yeah, the body's wild.
Okay, if it's not being treated, what are the risks there?
Yeah, so if sleep apnea is not being treated, there are some really serious things that can happen. I have some patients that have really had big time costs because they have not treated their sleep apnea. So the minor, somewhat minor, would be just daytime tiredness and irritability. That isn't necessarily that minor if you fall asleep at the wheel, or if you aren't performing at your workplace because you're feeling so tired. High blood pressure, like I mentioned. Stroke, there's an increased risk of stroke in people that have sleep apnea, especially men. So they've done a study where it would be like adding 10 years. Your risk of stroke would be like a 70-year-old if you were a 60-year-old without treating your sleep apnea. Heart problems, people that have untreated sleep apnea have an increased risk of recurrent heart attack, of atrial fibrillation, and of stroke. Congestive heart failure, this has been the biggest thing that I've seen in people, where what happens is when you have chronically low levels of oxygen in your lungs, you develop high blood pressure in your lung arteries. And it's kind of complicated, but it ends up affecting your heart and causing a type of heart failure. And then that type of heart failure leads to really significant ankle swelling and really significant shortness of breath. And people are uncomfortable. It's a scary feeling. They have a lot of air hunger, and there's very little that can be done to reverse it when it gets to that point.
Whoa.
So it's no joke having untreated sleep apnea, especially when you have really low oxygen levels. It's something that people, I think, like, oh gosh, I hate that mask. I don't want to wear that mask, or my wife hates the mask. But it's a really big problem, especially if you have significantly low oxygen levels at night. And then what's kind of a very frustrating thing is that Medicare won't pay for someone to use oxygen if they have sleep apnea and won't use a mask. So literally, if you're Medicare age and you have sleep apnea, you can't just get on oxygen. You actually have to use the mask. And sometimes people need oxygen too. But the other the last two complications, one is that people are at much higher risk of having a complication with surgery. So when you go to put somebody asleep for general anesthesia, you completely paralyze all their muscles. And so if their airway completely collapses on you and they have all this redundant tissue and this big neck, they're at much higher risk of not being able to be intubated or be intubated in the wrong way. And so that's really something that anesthesia folks are very conscientious about. And then lastly, it really can affect your partner. So whoever is sleeping in the same room with you, you know, they don't get good sleep. They're hearing your snoring. They're hearing you get up at night. And so that leads to, you know, maybe lack of intimacy or problems with your partner too.
Oh yeah, gosh, I can imagine. I mean, no one's getting good sleep in the house, so you take it out on each other, you take it out of the kids, you take it out at work, you're just in a consistent upset all day long.
Yeah, so thank you for not snoring.
Yeah, you bet, my pleasure.
And that's all I have for today about sleep apnea. Looks like we're out of time, so.
All right, well, you heard it here. It's time now to get out there, be a source of kindness, be a source of contribution. You have worth and something to offer this world, and I believe in you.